Hi everybody, this is a video about any links between psoriasis and chronic infections. Just before I jump into the meat and potatoes of the video, if you don't mind taking a quick second to either like or share or subscribe or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the question that was simply posted on one of my other videos was to the effect of, are there any links between chronic infections and psoriasis? So I wanted to post this video because I enjoy posting videos and reply to questions, and also because it's an interesting topic because psoriasis, I think, is an interesting topic. Psoriasis, for folks who don't know, is generally considered to be an autoimmune condition. A lot of folks are probably aware of the fact that psoriasis affects the skin, but psoriasis can also sometimes lead to what they call psoriatic arthritis, where folks get like crazy arthritis in their joints, kind of like rheumatoid arthritis, just it's psoriatic arthritis. So it's this weird kind of a cross-reactivity thing that happens. And because psoriasis is considered to be an autoimmune condition, it has a lot of underlying pathophysiological characteristics that are in line with the pathophysiological characteristics of chronic infections, like with Lyme, Bartonella, things like that, or mold illness as well. So with that preamble out of the way, I haven't noticed a direct connection between the typical chronic infections that I talk about in most of my videos, like with Borrelia, Bartonella, Babesia, Anaplasma, Ehrlichia, etc., nor have I seen a connection with it with chronic viral infections either. To be honest, while I have had some patients over the years where their primary issue is psoriasis, as my practice over the years has become more and more niched down into complex chronic illness, most folks don't come in where their only symptom is psoriasis, but many of the patients that I work with, they have psoriasis. They have psoriasis as one of the symptoms that they're dealing with, and usually it's like not on their top 5 list. Maybe it is in some cases, but usually it's like, oh yeah, I've got my chronic pain, fatigue, neurological symptoms, etc., and like, oh yeah, I have psoriasis too. So what I found in a lot of those cases is as we're working on treating the root causes of their illness, whether it's just rooted in chronic infections, or there's a mold component, or heavy metal component, or detox pathway impairment component, or something causing mast cell activation syndrome or whatnot, as we're working with treating the root cause issues, and then also working to help heal up their system, repair the damage from those root cause issues, rehabilitating their mitochondria, bringing their immune systems back into balance. It's very common that they'll say, oh yeah, my skin's doing better, by the way. And it's just kind of this nice, happy, incidental benefit of treating the rest of them. So, well, not every case of psoriasis is easy to treat. I've certainly had some cases where, a couple of cases over the years, like I just couldn't put a dent in it for, despite my best efforts. So I certainly don't have a 100% successful track record with psoriasis. With many of the cases that I've seen, we've at the very least seen improvements, and in a number of cases seen just total resolution of the psoriasis. In some cases where either folks I've worked with in the past that did not have complex chronic illness, and psoriasis was a notable reason they were coming in, or for folks who do have complex chronic illness and psoriasis is part of what's going on. There are certainly some cases where we get to the point where it's like, oh, my chronic illness symptoms are pretty much dealt with, or we're well on the way to recovery, but like, can we focus on my psoriasis because it's really bugging me? So some of the things that I found to be more specific treatments that have directly helped psoriasis in a more targeted way, shall we say, beyond just making the patient generally healthier and pulling them out of the depths of complex chronic illness, is low-dose immunotherapy has been very helpful for some patients. There's a formula that's for the fungus on the skin. It's called the SFF mix, skin flora-fungus, and that has been a game changer for some patients. There's sometimes benefit from other low-dose immunotherapy formulas, but it's relatively hit and miss. So the fungal formula tends to be the most commonly helpful one in that regard. And so one of the other things that I've seen to be very helpful in some cases when it comes to psoriasis is just making sure we're getting the right dose of vitamin D in the mix. And if you've been watching any of my videos over the last couple of months, I've been talking periodically about this vitamin D receptor resistance issue, and I haven't actually had a chance to run vitamin D receptor resistance testing on anyone with psoriasis so far, but I'd be really curious to see if that might be something that comes up, because it seems to be a big player for folks with different other types of autoimmune conditions. So thank you for the question. If anybody has any questions on this topic or anything else, just post it in the comment section below, and I will answer as soon as I can.